Hello dear students, we'll just identify a clinical case or clinical sign today. Just see this, what this condition or sign is. See that there is some edema in the nipple and areola and swelling all over the breast. You can see typical pseudo-orange. You can see ulcer here, thickening, palpate if you look at those thickening is there. Entire breast is involved, small few nodules here beyond the breast tissue. See that beyond the breast tissue, entire breast tissue and entire skin over the breast tissue and skin beyond the breast tissue also involved. It's very, very important. Now this is cancer en cuirasse seen in LACB, locally advanced carcinoma breast. Skin of chest wall is studded with hard fixed nodules like armor coat. It's very, very important. It's like armor coat. This is what is called a cancer en cuirasse. One of the typical cutaneous manifestations of the advanced carcinoma of the breast, locally advanced carcinoma of the breast is cancer en cuirasse, very typical. And other cutaneous manifestations are pseudo-orange, puckering, dimpling, nipple retraction, skin nodules, like this, ulceration, pseudo-orange. Pseudo-orange is it's a normal lymphatic involvement, so that edema of the skin occurs, whereas hair follicles and follicles get buried. Opening of the hair follicles and sebaceous glands get buried, looks like as if there is orange peeling. Puckering is just involvement of the just skin and causes puckering. Dimpling is Cooper's ligament from the petal fascia comes across the blood, that is being involved, so contraction occurs. Nipple retraction, lactiferous duct is involved. Skin nodules, skin involvement per se. Ulceration on skin involves, ulceration occurs. Eventually may cause fungation, food orange, I've already told. Cancer en cuirasse is entire skin over the breast and surrounding areas involved as a thick coat, thick skin, like armor coat. These are the different cutaneous manifestations. Now, effects of lymphatic obstruction are browny edema of the arm because lymphatic axillary lymph nodes are involved, so arm edema occurs. Elephantiasis chirurgens, lymphangiosarcoma after radical mastectomy, that is Stewart-Travis syndrome, MCQ question. Usually 10 years or more after that, after modified radical mastectomy, this Stewart-Travis syndrome occurs. There is lymphangiosarcoma after 10 years, not earlier, the long standing after lymphedema, after MRA, modified radical mastectomy. So answer the MCQ. The multiple nodules with signs in the breast is commonly suggestive of carcinoma breast, tuberculosis breast, actinomax the breast, Monders disease of the breast. So students, please find out the answer and put it in the comment box. I'll get back to you for the answer. So commonest site of blood spread in carcinoma breast is liver, lung, bone, brain. Again, put it in the comment box. I will give it the right answer at a later period. So students, hope you understood cancer en cuirasse, one of the cutaneous manifestations of the breast, very well. Thank you so much. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis, but it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination, with all illustrations, principles, different methods, different techniques, science. My SRB manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there, covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast, and other things. Include briefly gynecology surgeries. With step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that. In detail, explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues. Dissection and tissue approximation, the two parts in surgery. Dissection is a principle, essential. After this surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing for to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topic, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much.